Let's give a final word to Meryame Kitir, who is Belgian Minister of Development, Cooperation and Major Cities Policy. Meryame Kitir.
Dear friends, climate change is the biggest challenge that we, our children and grandchildren will face in the coming years. The effects of climate change are already a reality today. The air that we breathe, the water we drink, our food and our shelters and security. All will be severely affected, and they are key determinants of our health. Without climate justice, health equity will not be possible. They are all connected. Climate change affects us all differently, and the poorest bear the heaviest burden. Today, Africa concentrates a large part of the most devastating effects of climate change, while it estimates less than 4% of greenhouse gases. WHO estimated that between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths a year. Malnutrition, malaria, diarrhea and heat stress will affect our population with a larger magnitude than today. Areas with weak health infrastructure, mostly in developing countries, will be the least able to cope, to prepare and to respond. With the COVID pandemic, we have another example of how human activity can alter every corner of our planet, bringing humans into contact with new diseases. 75% of all emergency infections diseases in human cross from animals, and that is why we must reduce the risk of future epidemics and pandemics by restoring lost ecosystems and biodiversity. By fighting climate change and reducing population, there is an urgent need to reduce the effect of global warming, because if we do not, all the efforts and progress we make on global health will be useless. And this is why cooperation and partnerships are so important, to join efforts and co-create solutions. So dear friend, as you know, climate change is one of the priorities of my policy. Our focus is on adaptation in the least developed countries, because the local population in those countries is the most vulnerable, and systems, including for healthcare, are the most fragile and not always resilient to crises. Food, security and climate crisis in Africa are real and devastating, and I've seen it with my own eyes when I was on mission in Burkina Faso and Senegal some weeks ago. And I have decided to raise the Belgian Development Cooperation annual contribution to international climate finance from €70 million a year to at least €112.5 million next year. And I have also decided to launch a new climate partnership in the Sahel. During the next 5 years, together with our partner countries Mali, Niger, Senegal and Burkina Faso, we will restore 40,000 hectares of land. At least 650,000 people will benefit directly from this action and will be better prepared against the consequences of climate change. A bad rainy season should no longer mean hunger. So dear friends, I would like to stress the importance of events such as this one organized by Because Health and its members. This conference is an important opportunity for professionals and partners of different countries to come together and look for solutions on how to improve our actions. We need to ensure that health programs implemented by the Belgian International Cooperation use environment and climate sensitive lenses to mitigate effects on public health, but also that our programs focusing on adaptation measures to climate change make use of available health information and health determinants. So dear friends, I hope that the conference has been productive and insightful for all participations, and more importantly, that it will lead to concrete partnerships and results. Thank you for listening.